Hello, everyone. Thank you for joining us today for the virtual enrollment fair. Today we will go over Kaiser Permanente medical benefits for the 2024 plan year. Before we get started, I would like to brief everyone on a couple of housekeeping items. All attendees are muted and will remain muted throughout the presentation. And if you have a question, please type it in the chat box located on the right-hand side of the presentation screen. Be informed that if you do type a question in the chat box, everyone attending the session will see your question and your name. So if you have a question that is sensitive or confidential in nature, please reach out to the County Benefits Division. Lastly, today's webinar is being recorded and a copy will be posted in the Benefits Open Enrollment website. At this time, I will turn it over to our presenter, Charlotte Souza.
Thank you, Nidra. Hi, everyone. My name is Charlotte Souza. I am an engagement specialist here in San Diego. I've been with Kaiser Permanente almost 30 years now, long time. I was very young when I started. So I will be giving an overview about Kaiser Permanente for those of you who are considering Kaiser Permanente. And for those of you who have Kaiser Permanente, I'm going to be introducing some updates that you may not be aware of. So take advantage of all the resources you have as a member of Kaiser Permanente. Let's get started. So Kaiser Permanente is a nonprofit organization, largest nonprofit here in the country. We've been around for over 75 years, and we have over 12.6 million members, a very large number of members. We own and operate our own facilities. So we are the health plan. We are the medical facilities and doctors, and we are the hospital. So all of that is integrated, considered an integrated model. And together with a very robust electronic medical record that we implemented more than 15 years ago, everything is connected. So when your doctor prescribes a medication and runs some tests, he then refers you to a specialist. That specialist doesn't have to be repeating those tests because he can see the same information your primary care doctor sees. So it makes it convenient for you and avoid a lot of duplication on your end. Also, this electronic record is highlights, flags any allergies you may have, any reactions to medication. So when you go to an urgent care, same day appointment, that's not your Kaiser Permanente doctor, all that is highlighted in the system so the doctors know what not to prescribe you or give you that you may have an allergic reaction to. So it's very safe. We're also connected with the libraries as pharmacy and labs as well. So here in California, we have over 170 facilities throughout the state of California. As a member, you have access to any of those facilities. Most of these facilities have everything you would need in one place. You have the primary care doctor filled with family doctors and internists, pharmacy, laboratory, and x-ray. So you get all your care in one place without having to travel all over town. Some of these facilities, in addition to that, have urgent care centers, specialty, as well as outpatient surgery. So it's all in one place, which makes it, again, very convenient for you. Now, our doctors are Kaiser Permanente doctors. These doctors do not contract with any other health plan. They only see our Kaiser Permanente members. These doctors come from the best schools all over the country. They come in and they practice medicine. They don't have to worry about running a business, paying the phone bill, paying rent. They're there for the focus of the patient. And together with that electronic record, it makes it, they're equipped with the latest technology. So they can see your history of appointments, what your chronic conditions are, and they're there to take care of you. It makes it easy for them as well, and their care team as well. A lot of these doctors are bilingual. They speak other languages. If you happen to have speak another language or a spouse or dependent that's not within our staff, we do have the interpretive services available of over 150 languages as well. And remember, you can change doctors anytime or as many times as you would like. You can go on kp.org/search doctors and you can see what their profile looks like, how long they've been with Kaiser Permanente, are they board certified? We do have a very high board certification rate, male, female, and some of these doctors also teach at the leading universities as well. So you can see their profile online, and you don't have to be a member. Anybody has access to that. Now, you do have the ability of doing same-day appointments, next day, and weekends. It may not be your doctor if you need urgent and your doctor's booked, but call your doctor. Sometimes they have open slots and that you can see your doctor within that same day as well. And I mentioned the facility services all in one building, which makes it easier for you. Now, one thing I do want to say about our doctors is that when you're seeing your primary care doctor and it has to do with your skin and he feels you need to, he needs to talk to a dermatologist, they all, we have specialists that are on call. So that doctor, right when they're seeing you, can pick up the phone and talk to a dermatologist as an example, and get recommendations while you're there without you having to be referred and being seen an additional visit, just making it easy for you. Now, with the electronic medical record, you as a member have access to part of your electronic record. You can book appointments online, cancel appointments, you can refill your prescriptions, have it mailed to your home, pay bills. You can see your lab results, which is one of my favorites. Also, if you forgot what your doctor suggested and his recommendations, you can go back and look at his notes and you'll be reminded of what he recommended for you. The other capability is that with your doctor, you have access to telephone and video appointments, whether it's on your tablet or your smartphone or your computer, you have access to that. If you're in the high option plan, phone and video visits are available at no cost. And if you're on the lower plan, which is low plan, which is the HDHP, high deductible health plan, HSA plan, there is a small cost before you meet your deductible, and then it becomes 100% covered once you meet that deductible. But the phone and video visits are very convenient. Most of the time you can do your appointment, can schedule appointments that way. Sometimes your doctor may opt that they may need to see you in person, but you as a member, you do have care the way you want it if you prefer phone appointment. Also, last year we added the Get Care Now feature, and these are clinicians that are available 24/7, and it's kind of like an urgent care over the phone. And these doctors, providers have privileges most of the states in the United States. So if you have an urgent need, you can call. There's a feature that tells you how long the wait is. It may say, you know, add your phone number and they call you within that time frame. And they can answer your questions if it's something that's urgent. If it's a 911 type of emergency or threatening to your life or health, just go to the nearest hospital or call 911 and you'll be taken care of anywhere. The prescriptions is a new update. As you know, you don't have to pay for postage if you have it mailed to your home. You can also opt to have pick it up at one of the facilities, and it can be any of the facilities if you prefer to pick it up on your way home. What's been added is that you can opt for a same day or next day delivery. That's an option, but it is available at a cost. But again, you have options when having your medication delivered to you. Again, making it convenient. So care while traveling. Let me see if it's on the next page. So I want to say you are covered for emergencies and urgent care anywhere in the world. Now, if you're outside of the country, it's on a reimbursement basis. So you bring back all your receipts and your notes and submit a claim, and Kaiser Permanente reimburses you minus your cost share. If the urgent need or emergency happens within the United States, same thing. Sometimes you can let them know that it's Kaiser Permanente. They may be able to pay them directly, but again, it may more than likely be on a reimbursement basis. Now, if it's urgent, we have partnered with many clinics. Let me see if there's a map somewhere. Here's a map. So as you can see, we are not just in California, we're in 8 other states: Oregon, Washington, Colorado, Georgia, Virginia, DC, and Maryland. If you happen to be visiting those areas, even Hawaii, we do have Kaiser Permanente providers in those locations. So what you do, you can be seen there, and it'll be as if you were in your home area. Just pay your copay and be seen. You would probably need to set up a MRN account, medical record number, and you can do that online as well. If you happen to be in states where there are no Kaiser Permanente providers, you see the square, the circles in the triangles. That means that we have partnered with Minute clinics that include pharmacies. We partnered with Concentra Urgent Care Centers. And last year, towards the end, we have partnered with Cigna PPO Network, and they can handle urgent care visits. And what that means to you is you just pay your copay, and you have to be filing a claim and waiting to be reimbursed. You just pay your copay and you're seen. For the Minute clinics, they have a pharmacy. So if you need medications for that visit, you can use the pharmacy at the time for that visit and just pay your copay. Just making it easy for you. There are certain in the Midwest area, more towards the east. We do have another provider called the Little Clinic, which also include pharmacies as well. And what you can do is go to kp.org/travel or call them on the phone, and they can help you. They're available 24/7, and they can help you prepare for your travel. If you have questions during your travel or after your travel, if you have a claim, they'll help you with that as well. Now, if you before your travel, if you're getting close to your refilling your prescription, if it's to a certain point, they'll help you get it refilled if it's that deadline is not it's not due yet. So they help you with that as well. We do have a travel advisory that if you're planning a trip to another country, they do studies so they can tell you what are the diseases that are happening in those areas, and they'll send you a prescription to get you immunized before you head out to that country. You have to call them about 2 months before, and then they can set up the appointment and meet with you and review that information. It's pretty cool. So this is on travel. I do want to mention that it works the same way with out of area students. So if you have a college students in the Kaiser states, it's the same thing applies. And don't forget, you also have that 24/7 virtual care across the United States as well that you can call if you are in need. So we have statistics because we have the electronic medical record and we have over 12 million members. We do a lot of we can see a lot of statistics, and because of that, we can see that 33% are more likely to survive heart disease because we're so focused on prevention, as well as 52% more likely to survive colorectal cancer screening. And then, of course, 20% on premature death due to cancer. And this is because we are very focused on preventive. So on your app, on your medical record, you'll see that sometimes you'll get a reminder, hey, don't forget you're due for a mammogram or you're due for a colorectal cancer screening. And it also has if you're fall within that range, it has a feature where you can click on it and you get a fit tip that's mailed to you, and you send it back and it'll screen you for the year. Now those are every year. You'll be getting that moving forward unless you opt for the colorectal cancer screening. But we're very passionate about prevention. The nice thing is if you go see a specialist, an optometrist or dermatology as an example, they all can see if you're due for a screening. So they can remind you or book the appointment at that time. Again, very, very effective. Maternity care. We have a very comprehensive care team that supports your care and you. Now, the care team also has interventions early if you have a chronic condition such as high blood pressure. They make sure you're well taken care of. There's also classes on nutrition, infant care, and just so that you have a healthy pregnancy and a healthy baby when you have your baby. The kp.org/maternity care website is also very comprehensive, and it has articles. It also has breakdowns on each trimester and what to expect on each of those phases, and also has virtual tours as well. Resources for mental health. We do have psychiatrists, psychologists, therapists that can see you. You don't need a referral from your Kaiser Permanente doctor. You can call them directly and make an appointment. And they cover the entire spectrum from small anxiety disorders, depression, all the way to autism spectrum disorders. It also has providers on if you're facing addiction, or know someone that's a Kaiser member that's going through that, we also have providers for that condition. So if you're one-on-one with a therapist in person, it's your office visit copay. If you're seeing your therapist or provider via telephone or video, it's 100% covered if you're on the traditional HMO plan, which is a high plan. If you are in the high deductible HSA plan, there's a small cost attached to that all the way until you meet that deductible, then it's 100% covered. And this just gives you the spectrum. If you don't feel well, don't know what to do, you can also call your primary care doctor, and they're equipped to provide an assessment and direct you to the right care. We also, for Southern California, introduced a new triage number that you can call, and they'll direct you of where you need to go to. And then there's lots of resources that I can talk to you shortly on wellness and, just simple stress reduction techniques. There's so much that we offer. And then, of course, if it's threatening to your health or threatening to your life type of emergency, just go to your nearest hospital or call 911. But again, they handle the entire spectrum. And here's just an example. It's just broken out in a different way on our specialties and emergency and wellness resources. Now, tied to that, in addition, this is something that you can also do. We have self-care apps. The Calm app is a very, it helps for meditation, practicing mindfulness, and reducing sleep. It's very, very popular. We also have the Ginger app, and that's text-based coaching with a emotional support coach. That one is, again, text-based, and it's for coaches, available 24/7. They discuss goals, you share challenges, create action plans. You have skill building tools for the Ginger. Again, that's another one that it's very popular. And a lot of us like to text rather than speak to somebody. I would choose that one myself. I like to text. And then you have My Strength, which is more personalized for changing behavior. And that one was approved by our clinicians. They felt comfortable in us being able to offer that to our members. All of these are available at no cost. And again, this is an option. It does not replace your therapy, but these are available at no cost. You do need to go into your Kaiser Permanente account and set up the user ID and password. Once you're done with that, you can use them on your smartphone or your tablet. And I just mentioned all this information on Ginger. We just want to make sure you know about all the different capabilities that the Ginger app offers. And we started offering that towards the end of the year. So we want to make sure that you're aware that you have this particular app, again, at no cost. Now, right here, it says 90 days. So when you sign up for the first time and start texting with a coach, it's available for 90 days. Once the year is over, it resets, and then you can start using it over again. So let's talk a little bit about wellness. You have a wealth of resources on wellness as well. You have acupuncture, massage therapy, and chiropractic available at a discount. You have reduced rates for gym memberships, programs on and classes, telephone coaching, and also the ClassPass app as well. And we'll talk a little bit about that. The ClassPass is also a self-care app, and this one is for workouts. It has over 4,000 online video workouts on Tai Chi, Pilates, yoga, dance. If you want to focus on upper strength or lower strength, it has all those videos on demand, available at no cost. It also offers reduced rates for certain fitness classes throughout the community. And you can go in there, put your zip code or your city, and do a radius, and it'll download the different classes or fitness centers available to you in that area. The wellness coaching is, again, telephone coaching over the phone at no cost to you. These are sessions that you can have with an expert in the field that you choose. The topics include fitness, nutrition, weight reduction, stress reduction, and smoking cessation, even helping you sleep. These coaches are experts. For example, if you choose nutrition, you'll be speaking with a nutritionist, and you can join for the first time. It does take a little longer on the first one because you're setting up the goals, and then you can meet with them on a weekly basis or every other week. It's all up to you. And the sessions are only 20 minutes long, and they're available, I believe, from 8 or 7 in the morning all the way to 6 or 7 o'clock at night. So they're available throughout the day, and a time that works better for you. You can pick the time. And again, smoking cessation, nutrition, fitness, they're there for you, available at no cost for you. The kp.org website has over hundreds of healthy cooking recipes. It also has encyclopedias on health, nutrition, medications, alternative medications. It has plant-based recipes and so much more. It's kp.org, and it's available to the public. Again, it doesn't have to be a Kaiser member. This is available to the public. The classes are for members. These classes, the majority of them are available at no cost as part of the benefit. And some of these classes are such as sleeping well, taking care of your heart, emotional health, or the healthy balance class. These classes, again, are available at no cost. Some have separate sessions, and a lot of them are still offered virtually because of COVID. Some are like the diabetes class, I believe, is in person. So depending on the class, it'll be available either virtually or in person. Again, available at no cost. If you want to bring your spouse that's not a member, they welcome your spouse that's not a member that's coming with you. There's a lot of patient education videos, health tools, and health, nutrition, and counseling. If you want to see a nutritionist on a one-on-one basis, you can ask your doctor, primary care doctor, to refer you, and you can see a nutritionist on a one-on-one basis. There's also web-based coaching. You fill out the health assessment online, and then you can join interactive programs for keeping your stress in check, improving your mood, sleeping well, and so many others. Now, a lot of you are familiar with this because you have to do the total health assessment to get your incentive, but this is the same thing. But you do have those interactive programs that you can use. We do have the Positive Choice Integrated Wellness Center that's based out of the Garfield location in Kearney Mesa or Clemmer Mesa area. And this wellness center, they offer wellness seminars at no cost. They're free. There's plant-based mini cooking demonstration. There's fitness videos, even on yoga, and also breathing exercises to help with your stress. Some of the fee-based programs are the weight loss programs. A lot of folks come to me and say, oh yeah, I did the OptiFast, the full liquid diet, and that's the one that's monitored by physicians, and that one has a cost. and the rest of those type of programs. But those you don't need a referral, it's open to the public, so anyone can go there and have those attend those programs. Some of these are available via virtually. And again, you're speaking to experts in those fields. Again, the full liquid diet is monitored by physician, and also you probably need to get lab work done to make sure that everything's in check. But that wellness center is incredible. So the core office is again in Kearney Mesa, but there are satellite offices in the Otay Mesa location, El Cajon, and San Marcos. So their satellite offices available, and some of the classes are available in those areas. As a member, you have discounts, reduced rates for acupuncture, massage therapy, and acupuncture. They're available. They have like a 25% discount, and the provider would be American Specialty Health. You do not need a referral from your Kaiser Permanente doctor. You can call them directly and make an appointment, and you get the discount right away. So they have access to our system, and they know who are members, so they automatically give you the discount. The Active and Fit is fitness center, so there's over 12,000 nationwide. And for $28 a month and a $28 registration fee, I think you have to pay 2 to 3 months in advance. You can join these fitness centers. I know LA Fitness is there, Curves is in there, and it's $28 a month. You can change fitness centers monthly if you like, but that website also offers other types of discounts on vitamins, gym equipment, and so much more. So it's pretty very large list. So go into the website. It's called kp.org/choose healthy, and you can set up an account and then access the information on these services. Let's talk a little bit about your benefits. So as far as your traditional HMO plan, the high option, there are no benefit changes. This one, of course, does not have a deductible. You don't have to worry about paying a co-insurance. It's just no deductible, which makes it really nice. You do have a yearly out-of-pocket of $1,500 for individual, $3,000 for family. All that means is if you've been paying $25 to see your doctor and co-pays, hospitalization, medications, if you reach $1,500 in the middle of the year, you've reached the max and you've covered for 100% for the covered services for the rest of the year. It does reset January 1st the following year, but it's just a protection for you, a safety net. So again, if you have, if you're getting your physicals, your mammograms, your cancer screenings, it's covered at 100%. If you see your doctor, specialist, or go to urgent care or even outpatient surgery, it's a $25 copay. And remember, with a traditional HMO plan, your telephone and video visits, your lab tests and radiology, it's covered at 100%, just saving yourself a little bit of money there. If you're hospitalized, it's $100 per admission copay. It doesn't matter how long you're in the hospital. You could be in the hospital one day, you could be in the hospital a whole month. It would be $100 per admission. If you are sent home and you need to be hospitalized again, then it would be another $100. The emergency room care copay, it's $125. If you're if you're admitted to the hospital because of that visit, that copay is waived and you only pay your hospitalization copay. And remember, 60% of emergency room visits really should be going to urgent care, which is only $25. And the wait is not that long, because if you're there for something minor, they usually take the more severe cases first before they see you. So save yourself time as well and waiting in the emergency room. Now, prescriptions, $10 copay for your generic medication and a $30 copay for your brand medication. If you have up to have it mailed to your home for your maintenance medication, it's double the copay. So 20 for generic and 60 for brand medication. Our pharmacies also cover dental prescriptions as well. Just a little known fact for you. And again, you can order through the phone or order it online. Now the HSA, which is the high deductible health plan, HSA qualified, is a special type of product. Very interesting product. It does have a high deductible, but it's a company's a bank where you can save federal tax dollars for your covered services, your appointments, your prescriptions. And I know that you have tomorrow, Optum will be speaking. They're one of the banks, and tomorrow at 1 o'clock. Take advantage so you can understand the entire product, how it works, because it does accompany that, and that money is your money when it rolls over year to year, and you keep that money. It goes with you. If you retire, move on to a different job, that money is your money. Now, this HSA qualified deductible HMO plan has a deductible. For individual is $1,600, and then for family is $3,200. Even if it's one individual in the family, it's $3,200. These changes are due to IRS regulations, so that's why this changed. The out-of-pocket maximum, remember, this is your safety net. Once you meet that, you don't have to pay anything for the rest of the year. The out-of-pocket maximum for an individual is $3,200. For a family is $6,400. But if one person in the family reaches $3,200, which is their deductible, once they reach their deductible, they're covered 100% for the covered services for the rest of the year. So that's how that works. And again, preventive's covered at 100%. Your telephone, okay, so once you reach the deductible, then the co-pays start working. So you'll be paying 100% of that service until you reach the deductible. Once you reach that, these are your benefits. Doctor visits, lab tests, surgery, hospitalization, and emergency room visits, all covered at a 10%, which would be your member share. Your preventive is covered at 100%. Now, your prescription, once you meet the deductible, it's a $10 copay for generic and $30 copay for your brand medication, same as your traditional HMO plan. And remember, you're paying your 10%, you've already paid your deductible, so that plus that, once you reach your out-of-pocket maximum, you don't pay for your covered services for the rest of the year. Yet the health plan takes over. So it's a pretty nifty plan. It's very interesting. So these are your benefits. I'm going to pause here to see if there are any questions.
Charlotte, it doesn't appear that we have any questions in the chat just yet.
Okay, sound good. Thank you, Nidra. Yes, so that's why we're here for you. If you have any questions, please type in the chat. And remember, personal questions that are sensitive, please call Human Resources for those types of questions. And I'll continue. Now, for those of you who choose the high deductible health plan, the HSA, you have additional tools and resources with this type of plan. You can view your bills. You can do a cost estimation. You have to be inside your Kaiser Permanente KP.org account, and you can do estimates. I'm going to have knee surgery next in 3 months from now. I wonder how much that is, and it'll take into account what you've already paid, your deductible, and your out-of-pocket maximum. So it gives you the entire breakdown, and it saves it as a history if you want to review it later. It also tracks your deductible. It tracks your out-of-pocket maximum. So it's easy at a glance available for you. And here's one for prescription. You can see what prescriptions cost as well. Oh, that's the cost estimation tool. This is the, but there's one for prescriptions. Now, this is a something you would receive once you receive services, and it's called an explanation of benefits, which is a EOB. This is what you would get after your visit. So you would be expecting this, and it'll give you the entire breakdown as well where you're at. Again, you have this capability online, but you would be getting this document. You also have a dedicated microsite. So you have the KP.org website, but this one's created for the County of San Diego. So it's more personalized for the county employees. And if you're new to Kaiser Permanente, it has a new member onboarding, a picture of the new hospital in San Marcos that just opened a month ago, and so much more. It also houses your benefit summaries, your SBCs, and your explanation of benefits, which are provide more detailed information about your benefits. And here's that QR code right here. And this is just letting you know that we provide high quality care. These are organizations outside of Kaiser Permanente. They're independent. These are very well-known organizations that go out there. They screen the health plans, and they give them a rate. And Kaiser has received top rated in the state for 7th year in a row. Also the California Office of Patient Advocates. We've had high scores with them on behavioral mental health care and appropriate tests and treatments and procedures. And then the last one is leading California in 74 effectiveness of care measures, which is the HEDIS report that we score very high. Some of them are preventive, filing claims, and so much more. So these are just organizations outside of the health plans that are independent organizations, very well known, reputable, that recognize the health plans. And you're getting high quality care with Kaiser Permanente. This is just a snapshot of what it looks like in the Bay Area. You can see we're very well known in Northern California, and that's where we started. And here's Southern California. And you can see that some have that little box, which means these are affiliated planned hospitals that we've partnered with. And for those of you who live in North County, San Diego, we partnered with Palomar Hospital. And because we now have our new San Marcos Hospital, that partnership will be going away, but there'll be small services that they will continue with us, and that would be on a referral basis. But again, your new hospital in San Marcos will be the San Marcos Medical Center. And here is some of the newer facilities, and here's the San Marcos that has recently opened. Very, very exciting for us. I live in Vista, so I'm very excited for that. And here's a sample of what the hospital looks like. It's not as big as the San Diego Medical Center in Kearny Mesa. It has 109 capability of over 200 beds, but I think they opened half of that, or a little bit more than half. And as the population grows, it'll be a full-blown hospital. You can see the specialty care specialties that they offer there. Maternal health, which is very, very important. It's available there. Even the neonatal level 2 intensive care unit, it will be available there as well, or is available. And remember, these new hospitals, the San Marcos and the San Diego Medical Center offer private rooms, so you're no longer sharing a room with another patient. So that was a very big ask from our members a while back. Very technologically advanced, very interesting. The Target Clinic. So this is separate from the mini clinics that I mentioned earlier. These Target Clinics, we have partnered throughout Southern California, not in Northern California, only Southern California. And these offer over 85 types of services. They mostly handle minor injuries, minor illnesses. They can do physicals, and you can even get your flu shot there. These are manned by our Kaiser Permanente providers that have access to the electronic medical record. You can book your appointment before you go. You can walk in and be seen. Again, minor injuries, minor illnesses, and they're open 9 a.m. to 7, Monday through Friday. They're also available on the weekends, 11 to 4. So you have that also available to you. This is an additional option. If they give you a prescription at that time for that visit, you can use the pharmacy and just pay your copay. If you need refills or you need ongoing care, you do need to go back to your Kaiser Permanente doctor. For those of you who are joining Kaiser Permanente, we do have a team that onboards our members. As a Kaiser Permanente member, you'll be utilizing the services at Kaiser Permanente, so they'll help you establish yourself with your doctor at Kaiser Permanente, help you transition the records, and set up your first appointment. And then register on kp.org. A lot of, because we're electronic, other providers also have electronic. If they do, we do need your authorization, and just by pressing the button, they'll transfer your medical records. Excuse me. So in summary, I provide you with all of our, what is this? Oh, just the different capabilities that we have. You have 24/7 phone and video visit capabilities. All of our services, a one-stop shop. You also have all those wellness tools and resources available to you. And again, if you have questions after the meeting today, we do have a special number that you can call. And just by letting them know you're with the County of San Diego, they can provide you with additional information, same information that provided here, or if you need more, they're available Monday through Friday from 7 in the morning to 6 p.m. Pacific time. Thank you so much for having us here, and I'll go ahead and again, I invite you to join Kaiser Permanente, and I'll go ahead and turn it over to Nidra to tell me if there's any questions.
Thank you very much, Charlotte. We did have a couple of questions that came through the chat while you were presenting. And I went ahead and answered a couple of those, but just for the audience in general, there was a question regarding the HSA and what happens to the funds in that account. Can you go over that one more time for the audience?
It's good to get that information on the Optum webinar, but with HSA in general, when you put money into that account, it's not like the FSA where if you don't use it, you lose it. It's money that is yours, and you can continue adding year to year, and it rolls over, and that's your money. And again, it's if you end up retiring or moving on to a different job, that money goes with you. I hope that answered the question.
Excellent. We do have another question in the chat. Do any of the health plans cover fertility treatments and or diagnosis?
Yes. So it all depends on the type of fertility. The traditional HMO plan, if you see a provider, you would pay your office visit copay. Let me go back to the benefits. There. So for the, and it's good to get your evidence of coverage because it'll have detailed information, more detailed. For those of you who are Kaiser members, you would call the fertility clinic and they can write you up a plan and tell you what's covered, what's not. In general, if you see a provider, it would be a $25 copay. If you're getting labs, it'll be no charge. Now, once you get into in vitro, that is not covered. So it's best to go into the evidence of coverage just to get an idea in more detail of what the coverage looks like. Now, for the HSA qualified deductible HMO plan, fertility treatment is not covered. Hopefully that answered the question.
Great. And while we're on this slide, a follow-up question regarding the breakdown for the deductible and the coinsurance under the HSA. Can you elaborate a little bit more on that or go back in detail?
Sure. Okay, so with the HSA, when you go see your doctor and he prescribes medication and orders lab test, you would be paying 100% of that cost of those services. So let's say the doctor visit is $100, the lab test is $25, you'd be paying the full cost of those benefits. Once you reach for one individual $1,600, then you would be paying 10% of those office visits. Whether it's lab tests, you'd be paying 10% of those. Unless it's preventive care, such as your physicals, your cancer screenings, that would be covered 100%. But once you meet the deductible and pay the 10%, you're adding the 10% of the services and $1,600. Once you get to $3,200, that's your out-of-pocket maximum. So that means that once you reach that, you've capped out. The health plan takes over 100%, and you don't pay any of the covered services for the rest of the year. Beginning January, it all resets all over again. Everything goes back to zero. Let me know if that helps.
Perfect. Right now, the chat box is pretty quiet. Feel free, everyone, to type in your questions. Now, Charlotte, at the top of the hour, 2 p.m., are we going to do a repeat of presenting the slides, especially for those who may have joined in after the session started?
You want me to present it again?
Yeah, if you can. Yeah.
Sure.
We have plenty of time, so I want to make sure everyone can get their questions answered and.
Sure. Okay, so this is an overview about Kaiser Permanente, and we'll provide additional resources that you may not be familiar. So we'll review that. Kaiser Permanente owns and operates their own facilities. So when you become a Kaiser Permanente member, you'll be getting your services at the Kaiser locations. You'll be seen by Kaiser Permanente doctor, and we are the health plan, but we're also the specialist, the primary care, pharmacy, lab, and telehealth services where you are at the center. We have a very robust electronic medical record, which equips our providers to take better care of you. As a member, you have access to part of that record. The nice thing is avoids a lot of duplication, and if you have any allergies or reactions to medication, all that is flagged in the system. So if you go to a same-day appointment with urgent care or go to the emergency room, they know that you are allergic to that certain medication, and they can treat you more effectively. Our doctors are Kaiser Permanente doctors, so you'll be seeing a doctor of Kaiser. You can go on kp.org/doctors, and you can see their profiles, how long they've been with Kaiser Permanente, what are their areas of expertise, male or female, what schools they went to, and so much more. And remember, you can change doctors anytime. If you commute, you can schedule establish yourself with a doctor in your work or vice versa. You go home, and you're on vacation, you don't feel well, you can see anyone close to your home. So don't have to ask for permission. You can see another urgent care center or make an appointment with another doctor in your area. And again, same day, next day appointments are available. We do have routine appointments that are available in the weekends as well. Our facilities, the majority of them, we're all over California and several other states. We have pharmacy, lab, x-ray, and primary care available in one place, so you don't have to be traveling all over town, saving yourself a lot of time and a lot of gas money. So I mentioned you have access to the electronic record. You can book appointments, cancel appointments. You can order your prescription refills and have it mailed to your home. Again, makes it very convenient. You can pay your bills. And my favorite is viewing your lab results. You can see your lab results and it tells you if it's within normal ranges or if it's a little off. If it's a little off, you're going to get a call from your doctor, but you can tell, you can keep track on your own, and it helps you be more proactive. It also has a feature on, it's called the personal action plan, where it tells you where you're at as far as your preventive care screenings. And depending on your age, gender, it'll tell you what's due, and it helps you be proactive with your care. A new feature that rolled out last year is the 24/7 Get Care Now. There's two things. You can also see your doctor in over the phone or have an appointment via video for your regular routine doctor care. This right here is Get Care Now, which means that we do have clinicians that are on call and available 24/7. Whereas if you don't know what to do, you need to talk to a medical professional, you can click on that feature while you're in your kp.org account, and it'll tell you how long the wait is. It could be 10 minutes, 15 minutes. I've seen one where it's 20 minutes, and you can wait, or you'll provide your phone number and then call you 20 minutes later. And they'll consult with you and take care of your questions. The prescriptions, I mentioned earlier that you can have it mailed to your home with no cost to the postage. But now you have the capability of having it delivered same day or next day. Those two are available at a fee, but now you have the option if you wish to have it earlier. They generally take around 7 to 10 working days. Travel, you are covered for emergencies anywhere in the world for urgent and emergency. And we do have a travel department that can handle questions before, during, or after your visit. And so they can help you with your prescriptions, make sure you're refilled. They can help with if you have any questions, where should I go if I need urgent care, or after a visit, if you had a claim, they'll help you with reimbursing, getting you reimbursed minus your cost share. They're available 24/7 over the phone, or of course, we do have the travel kp.org/travel website. I mentioned the coverage all over the internationally and the US. Now the US, you can be seen at any of the Kaiser facilities that you see here: Virginia, Maryland, DC, Georgia, Colorado, Oregon, Washington, and Hawaii. And you just present your card, they'll set up a new medical record number for that particular region and be seen as if you were in your home region. If you happen to be outside of these Kaiser states, we do have mini clinics, Concentra urgent care centers, little clinics that you can be seen for urgent care. And towards the end of last year, we partnered with the Cigna PPO network to handle your urgent care needs as well. And all that is on kp.org/travel, or you can call the travel line. Now, the cool thing about this is that you don't have to be filing a claim and waiting to be reimbursed. You just pay your copay and be seen, and that's it. For the mini clinics and the little clinics, they do have pharmacies, so you can use those pharmacies, pay your copay and be seen, get your medications for that visit. They'll allow you to use the pharmacies at that time. So that's when you're traveling. And the same type of service applies to college students as well. And remember, we have that 24-hour, 7 days a week virtual care that's available across the US as well. And because we have that electronic medical record, We do a lot of research, a lot of screenings. We have statistics that show that we have 33% more likely to survive heart disease, 52% survive colorectal cancer screening, and then 20% experience less likely to experience premature death due to cancer. And that's because of our health record, our electronic health record, and the fact that we're very focused on preventive care. Now, maternity, we do have a very comprehensive care team that will take care of you throughout your pregnancy. And they also are available. There's interventions if there's a high risk. There's additional steps taking place. You do see additional specialties, classes on nutrition, infant care, and so much more. So you can have a healthy pregnancy and have a healthy baby as well. The kp.org/maternity care website is a very robust website that offers information on each of the trimesters, what to expect when you're going through that trimester. It also has articles and virtual tours of the facilities where you will be delivering to. And remember, our hospitals are now have private rooms, so you're not sharing a room with another patient. So that's a big deal for a lot of our moms. Mental health services, wide range support for our members for emotional and mental health, anywhere from anxiety, depression, addiction, and autism spectrum disorders. You're either seeing psychiatrists, psychologists, therapists. You can see these providers with no referral needed by your doctor. You call them directly and make an appointment. We also have self-care apps available. If your visit is in person, you pay your office visit copay. If it's via telephone or video visits, with your traditional HMO plan, it's covered at 100%. If it's in the HSA low plan, the high deductible health plan, it has a small fee up until you reach your deductible. Then it's covered at 100%. And they also have group visits as well as other types of classes that you can take and support groups as well. This just gives you the many services. If you're not sure what to do, you can also call your doctor. They're equipped with doing the assessment and directing you to the right care, the right time. And we also have specialties on substance use disorder. If it's an emergency, such as a 911, life-threatening, threatening to your health, any hospital is covered. And then we do have a new single number that our members can call. If they're not sure what to do, they will triage you to the right care at the right time as well. And down here is the different support groups that we have, as well as community resources. And that's the same thing. Now, tied to that, we have self-care apps, and these apps are for reducing stress and improving sleep, basically managing your overall mental wellness. And these do not replace your therapy. These are an addition, or if you just want to use this on your own. The Calm app is very, very popular. It's well known for its meditation, practicing mindfulness, helping you sleep. My son uses it to help him sleep. I have a colleague of mine that uses it for her children to tell sleep stories. Again, it's very popular. If you were to obtain this outside on an application, there is a cost attached to it. With Kaiser, when you enroll, it's through your kp.org account, set up your user ID and password. It's covered at no cost. You can then use it with your smartphone or your tablet. The Ginger app has a lot of the same capabilities, but it is one-on-one text-based with the emotional support coach that's available 24/7. And then the My Strength app is more personalized. It's more for changing behavior and strengthen your emotional health. Again, all of these are covered at 100%. If you log in, I believe you have to be in a computer to obtain these apps, and then set up the account, and then you can start using your smart devices. And this just tells you a little bit more about the Ginger app. Again, you're discussing goals, you're sharing challenges, you're creating action plans. There's skill building tools, a library of over 200 activities, and you can log and track your progress. So the next few slides, we're going to talk about your wellness tools and resources on gym memberships, programs, and wellness coaching. There's another app called the Class Pass. The Class Pass is for workouts and exercise. It has over 4,000 on-demand online videos available at no cost, anywhere from yoga, tai chi, kickboxing, Pilates, dance. There's so many different variations, and at no cost, it's free. So you can log in at a time that works for you. There's also reduced rates for fitness classes throughout the community that you can also get discounts on those particular programs. Telephone coaching by phone is coaching on nutrition, fitness, weight reduction, stress reduction, and smoking cessation. And you can set up a call. The initial call does take about 30 minutes, and then you can check in with these coaches over the phone. And these are 20-minute sessions, and you can do it every week, every other week, and adjust your goals as you go. It's very, very effective. These are experts in those areas that have access to your electronic medical record. So if you have a chronic condition, they can tailor it more to you. Again, available at no cost. The kp.org website's available to the public. It has hundreds of healthy cooking recipes, meal prepping, all kinds of different recipes. If you like vegetarian, you want kid-friendly food, you can narrow it down to those specific categories. And it's a lot of people like these recipes. Now, kp.org also offers encyclopedias on health encyclopedias on drug and alternative medication as well. There's classes and programs available to our members. The majority of them are available at no cost. A lot of the classes are their diabetes, cholesterol, high blood pressure. There's also sleeping, sleep well, helping you sleep, taking care of your heart, and also emotional well-being. And then the healthy balance class. So a lot of these are offered in several sessions, and a lot of these are offered virtually. Again, at no cost. Take advantage of these services. And then a lot of you are familiar with this one. This is a web-based coaching. You fill out a health assessment online. It only takes about 10 minutes. And then based on the results, you can join interactive programs, keeping stress in check, improving your mood, sleeping better, and several other programs as well. But it's web-based for those of you who rather do it online. And here in San Diego, we have a special center called the Positive Choice Integrative Wellness Center. They are open to the public. They offer a lot of services such as wellness seminars, fitness videos, breathing exercises, a lot of great information at no cost. It's free, a lot of free resources. They also offer programs that have a fee, such as the full liquid diet, the meal plans, half meal plan, half liquid, or the full meal plans, biofeedback, breathing exercises, and mindful program. There's a lot of different programs available at a fee. The full liquid diet, whenever I'm out in the field, I hear a lot of people that, oh, I lost so much weight. I love that class. It is a program that has several sessions, but there's a lot of great stories that I hear out there on this particular department. And again, open to the public, not just Kaiser Permanente members. Now, you also, as a member, have discounts on chiropractic, acupuncture, and massage therapy. And it's through American Specialty Health, which is a provider of all these organization that offers these providers. You do not need a referral from your Kaiser Permanente doctor. You can call them directly, make the appointment, and get the discount automatically. So again, you don't need a referral. It has a library of all sorts of articles. You also get discounts on vitamins, gym equipment, and so much more. The bottom is the fitness centers. So you can get with Active and Fit, you can sign up, create an account, and pay $28 a month. Registration fee is $28, and I believe you have to pay for the first 3 months, and then continue paying. You sign up with a gym, and you can change gyms once a month if you like, but you can check out those gyms that are out there. You can put your zip code and do a radius of 20 miles or 50 miles, and it'll give you all the different gyms available in your area, and sign up. So a little bit about the benefits. The traditional HMO plan, there are no changes to that plan. So it's a strict HMO, traditional HMO, no deductible, no coinsurance. You just pay your copay as you go. So no surprises there. Very easy, saving a lot of money because it's a very rich plan. Preventive care services, telephone and video visits, lab tests, all covered at 100%. Your doctor visits, whether it's primary care, your specialist, urgent care, your outpatient surgery, all covered at $25 copay. Very, very rich plan. Hospitalization, if you're hospitalized, it's $100 per admission. It doesn't matter how long you're in the hospital. You could be there a few weeks. It's $100 copay. If they send you home, you have to be hospitalized a month later. It'll be another $100 copay. So it's per admission. Your emergency room care copay is $125, waived if you're admitted to the hospital. Prescriptions, $10 copay for your generic medication and a $30 copay for your brand medication. If you're taking ongoing medications such as thyroid, high blood pressure, cholesterol, anything on an ongoing basis, you can have it ordered and you pay 2 copays and you get up to 100-day supply if you have it mailed to your home. So you're saving yourself a copay and you get a little bit more than the 90 days. The HSA qualified deductible plan is the second plan. The slight change is on the deductible and the out-of-pocket maximum, and that is because it's regulated by the IRS. So that changes went to a $1,600 deductible for employee only and $3,200 deductible for a family. Now, if you paid your deductible and your coinsurance, you have a protection, which means that if you paid your deductible, your coinsurance, and all these copays, if you reach $3,200, you are protected. The health plan takes over 100%, and you don't have to pay anything for the rest of any of the covered services for the rest of the year. If you are in the family, if it's $6,400 for the family. But if one person in the family reaches the $3,200, that one person doesn't have to pay any of the covered services for the rest of the year. So that's how that works. Now, once you reach the deductible, just going back to that, then your benefits kick in. Your preventive continues to be 100% covered, but your other services, your doctor visits, your lab tests, your outpatient surgery, hospitalization, and emergency room visits will have a 10% coinsurance. So again, this is after the deductible. So you're responsible for 10% of the cost. Once you get to the $3,200, then again, you're 100% covered for those covered services. The copay is $10 generic, and then a $30 for your brand medication. And again, you have the mail order incentive. I'll go ahead and pause here to see if there are any questions.
Yes, Charlotte, we had one question come in when you were going over the Choose Healthy program. The
Okay.
question is, can you choose any chiropractor or is there a limited list to choose from?
So the chiropractors is for through American Specialty Health, which is an organization that has a network of providers, whether they're acupuncture, chiropractic, or massage therapy. So you would use one of their chiropractors, and you can go on kp.org/choose healthy, and it'll give you, you can generate a directory based on your location, but it has to be one of the providers. You're welcome. Any other questions, Nidra?
That appears to be our only one so far.
Okay, so we'll continue. So if you plan to choose the high deductible health plan, you have additional resources. You, if you're registered on kp.org, you can track your deductible, you can track your out-of-pocket maximum, and you can see where you're at. You can also do estimates. So if you're planning a certain surgery or hospitalization, you can do an estimate based on your benefits and where you're at on your deductible and out-of-pocket maximum. It'll give you an estimate. Now, there's a phone number down here that you can also call. If you call the regular member services line, they can direct you to the right number, but they're dedicated to calls pertaining to the deductible plan. Again, it just makes it easier on you. You can do it on your phone or your tablet. Here's what the estimation tool looks like. It just makes it easier on you, and it takes into account what your benefits are, and it'll give you the benefit. If the service is really high in dollar amount, contact member services so you can work through a payment plan, and they'll work with you with regards to that. If you qualify for certain resources, they'll also tell you about that as well. Now, after your visit with a provider, you would get an explanation of benefits, which is called an EOB. It pretty much tells you where you are at in your deductible and your out-of-pocket maximum and what the total amount was. And basically, it's the same information that you can access online, but you would be receiving an explanation of benefits. So for County of San Diego employees, you have a dedicated microsite that houses your benefit summaries as well as your SBCs and your evidence of coverage. It's also personalized with resources that we think that you would want to access. Here's a total health assessment, accessing video visits. If you're new to Kaiser Permanente, what to do and how to transition your care, and maternity care, and the active and fit, and then the high deductible health plan. So it has a lot of information. It can take you straight to the kp.org as well, but this is available to all employees, not just Kaiser Permanente members. This is just letting you know that you're getting high quality care from Kaiser Permanente. There's several organizations, reputable organizations out there, such as the National Committee for Quality Assurance that has rated Kaiser top, rated Kaiser for 7 years in a row in the quality of care. There's also the California Office of Patient Advocates Healthcare Quality Report Card, again, rating us with a 5 stars, which is a maximum that you could get, and then the HEDIS, which is the Healthcare Effectiveness Data and Information Set. And they look at 74 services and has rated Kaiser high as far as the quality of care. Going into the locations area, this is California. Basically, it just gives you a snapshot what the locations of Kaiser Permanente look like. And then here's Southern California. You can see we're all over San Diego down here, and there's plenty in Los Angeles area as well. As a member, you have access to any of those. If you have children that are going to college, they can use any of those facilities that you see here. Here are some of the newer facilities in our San Marcos Medical Center, new hospital, just opened a month ago. It has robotic surgery, virtual fall prevention. These are private rooms, which is a big ask from our members. It has maternity as well as a level 2 NICU, which is ICU for babies. And it has all these other specialties in this facility. And don't forget, it's right next to the medical office building as well, where urgent care is there as well. Now, for those of you in Southern California, you have access as an additional service, the Target clinics that you see here. The newer ones are Seal Beach and Moore Park. And in San Diego County, there's 5 of them located throughout the county. Basically, you just pay your office visit copay, whatever your cost share is, and you'll be seen by a Kaiser provider who has access to the electronic medical record. Again, they handle minor illnesses, minor injuries. You can also do a physical exam. I took my son for sports physicals, so he could join football. And you can even get your flu shot there, and it gets registered into your electronic health record. You can use the pharmacy for that visit at that time and pay your copay. Any refills or any follow-up visits must be with your Kaiser Permanente doctor or pharmacy. And they're available Monday through Friday, as well as a shorter amount in the weekends. The weekends are 11 to 4. Monday through Friday is from 9 in the morning to 7 o'clock at night. For those of you who are joining Kaiser Permanente, welcome. We do have an onboarding team that will, they're experts in getting you situated. As you know, when you join Kaiser Permanente, you'll be utilizing the services at Kaiser Permanente. You'll be seeing a Kaiser Permanente doctor, so they'll establish you with a doctor and also help you with transitioning your records as well and setting up your first visit with your doctor. And remember, if you have an emergency or emergency that's life-threatening, threatening to your health, and you are in the San Diego area, any hospital is covered. My son, I called 911. He was having a seizure, and they took him straight to Tri-City. They don't care what your coverage is. They'll just take you to the nearest hospital. That's where they took my son. And what I did is fill out the claim form, and they got paid directly minus my cost share. So urgent care, again, is with Kaiser Permanente, and your routine appointments are with Kaiser Permanente. And in summary, I mentioned the high quality personalized care that we offered, all of our convenient services, a 24/7 video and online video appointments and phone appointments, as well as our 24/7 clinicians and our membership apps in the wellness tools and resources that we offer. And here's an additional phone number that you can use if you have questions after we're done with this meeting. They're available from 7 in the morning to 6 p.m. Pacific time, Monday through Friday, if you have additional questions, and that's a number that you can call. Thank you so much for listening to this presentation. Again, my name is Charlotte Souza, and I'll welcome your questions. And for those of you who are considering Kaiser, I invite you to join Kaiser Permanente. Thank you.
Thank you very much, Charlotte, for presenting again. We did have a couple of questions come through. One is regarding the fertility services. Could you enlighten us on additional information on that?
I should have mentioned that, huh? Let me go back to the benefit slide.
Perfect. Thank
So
you.
the fertility services, for the most part, if you're on the traditional HMO plan, is covered the office visit copay if you see a provider. Lab test is covered at 100%. So it's what you see here. To get more detailed, because then you get into in vitro, which is not covered. It's best that you get planned by the fertility clinic, so they can tell you what the breakdown is. I I will also direct you to the evidence of coverage that you can access that has more detailed information, because there are certain services that are not covered. But for the most part, if you see a provider, then you would pay your office visit copay. And there's certain medications that would not fall under this as well. The HSA the high deductible health plan fertility services are not covered.
Thank you, Charlotte. We had a question come in regarding the rates, and I did post in the chat a link to the open enrollment webpage for all county employees. So if you'd like additional information regarding the payroll deductions and the premiums for plan year 2024, again, the link to the open enrollment webpage is posted in the chat. So for now, it looks like no more questions as of yet in the chat. We'll keep it open for everyone. I'd also like to remind everyone that a copy of this presentation will be posted on the open enrollment website. So if you'd like to listen to it again and see the slide deck once again for your own personal reference, the posting will probably be at the end of this week. And you can always reach out to the Employee Benefits Division as well for questions that you have. Okay, Charlotte, a question. Does Kaiser have a fitness program that offers discounted gym membership?
Yes, and there's two things. One is, let me see where it's at. Did I skip it? Okay, it's before all this. There's the Active and Fit, which has over 12,000 fitness centers that you pay $28 a month and a $28 registration fee. And you have to pay the first 3 months, I believe. And then you can change gyms from time to time or monthly basis, I believe. Now, LA Fitness, Curves are some that I recognize that are in there, but you can go into the kp.org/choose healthy and put your zip code, and you can do radius of 10 miles, 20 miles, and it'll give you, you can download a list of the different fitness centers around your area. And then you also have the, where is it? Class Pass. This one was introduced, I believe, early last year, maybe the year before. That's a self-care app that has over 4,000 on-demand fitness classes. And these are online video workouts such as yoga, tai chi, kickboxing, dance, many others. And those are available at no cost. And this one also provides reduced rates for certain fitness centers throughout your area. Hopefully that answered the question.
Yep, we got to thank you, Charlotte. So thank you.
Thank you.
All right, we'll hang tight for a few more questions. Feel free, anyone, to type it in the chat box. Well, Charlotte, it looks like there are not any more questions filtering through. I believe we can wrap it up.
Okay.
I certainly want to thank you for the wonderful presentation, very informative. Thank you for everyone for joining us today. So Charlotte, if you have any closing remarks, feel
No, just
free.
thank you. Thank you, everyone. Make sure you get your flu shots. The clinics are available for you to just swing by and get those flu shots taken care of.
Oh, wait, we have a question come through. Is there a co-insurance on the very first doctor's visit in the calendar year under an HSA? Or those covered under the high deductible health plan?
On the high deductible, yes. So there is a co-insurance. It's a 10%. Let me go back here. So, and remember, you have to first meet the $1,600 deductible. So you would pay 100% of the total cost of that service up until you reach 1,600. And then the doctor visits, whether it's specialist or urgent care, then becomes 10%. The benefits kick in after the plan deductible.
Excellent. Another question. Will we be able to rewatch this video? And I'd be happy to answer that. Yes, we will be posting a copy of this recording on the open enrollment website. I would recommend giving it till at least the end of the week. So again, it will be on the Insight Open Enrollment website. And you're most welcome, everyone. We're happy to answer your questions. All righty. I believe this does conclude the webinar. Just like to remind everyone, if you have any questions after the fact, please reach out to the Employee Benefits Division. You also have your department HR officers and benefits ambassadors that are well informed on a lot of our plans. So at this point, we will conclude our webinar. Thanks again for joining us and have a great rest of the day.
Thank you. Stay safe.